Hi, I'm Dr. Siva Charan Reddy. I'm a surgical gastroenterologist and a minimal access surgeon, and also a robotic surgeon working at Yashoda Hospital, Hitec City. Today we'll be discussing about robotic surgery. In fact, I'll give you a brief walk around of the robotic system, how it works, and the robotic theaters. Before that, I'll talk about what are the common surgeries that are performed by a robo in GI surgery. The most common surgeries being GI malignancies like colorectal surgeries, rectal cancers, colonic cancers, pancreatic cancers, some of the benign conditions of the pancreas, gastrointestinostomies, liver cancers, liver tumors, gallbladder cancers. In fact, all GI cancers, it is better to do by using a robo than by regular conventional laparoscopic surgery. The biggest advantage of using a robo is less pain, faster recovery, and precision. Coming to the robotic system, this is the Vinci system, as you can see by the name here. This is the latest Vinci model that we are using at our hospital at Yashoda. This basically consists of 3 parts. This is the robotic console where the surgeon sits and operates. So in fact, the position would be like this, where the head of the surgeon is going into the console. We'll have arms which come down once the system is on, and we have rest of the equipment that are operated from here. There are 2 more which I'll get to you shortly. One would be the actual robo which performs the surgery. So by using this, we control the robo which is performing the surgery and the accessory system which supplies the electricity, the cautery, the cutting system, the light source, the gas, everything is coming from the third part of the robotic system. So this is the second and the most important part of the robo which performs the surgery. This is the cart which goes to the patient, which sits on the patient and operates. As you can see, there are 4 arms. These are docked into the ports, and then the instruments which are attached to these arms perform the surgery, which are controlled by the console which I have shown you earlier, where the surgeon sits and performs the surgery. The advantage of having 4 arms is a regular surgeon can have 2 arms, and then with the assistant you can have another 2 arms. But all of that can be done by a single robo, and then you can have an additional stability, additional visibility, less clutter, and better results, obviously. So this is the third part of the robotic system. You have the screen here. You will have a couple of accessory equipments. You have the energy source, the insufflator, the gas that goes into the system. This, in fact, is where all the important accessories go in.